Welcome to Cleveland Clinic.
My name is Sylvia.
And I'm Roshan.
We're the chief residents for the Internal Medicine Department. We're so glad that you have joined us today, and we're excited to introduce you to our program. We're located in sunny South Florida in Weston near Fort Lauderdale. We're one of the top healthcare systems in Florida with all internal medicine rotations in one campus.
Let's take a look at the schedule. Our rotations use the X plus Y system, in our case 6 plus 2, to balance out the combination between inpatient and outpatient rotations. 6 weeks of floors, ICU, nights, or electives, with 2 weeks of an ambulatory block for our categoricals. Our blocks are organized into 2-week blocks with the exception of inpatient floors, which is 4 weeks. What you will notice is that in your PGY 1 year, you spend most of the time on the floors and in general medicine in order to build the basic foundation for the rest of your internal medicine career. As you progress towards your 3rd year, you will have more electives, up to 8 blocks in a given year. In our program, we do not have a 24-hour call, we instead have a night float system. Another interesting aspect of our program is the vacation and holiday time. We offer 15 vacation days plus 5 sick or personal days. We also have a winter holiday schedule where we add 5 to 7 days for vacation separate from your allotted 15 days.
Let me introduce you to our hospital. We currently house 212 general floor beds, which includes our observation unit. We also have 48 beds in the intensive care units and 40 emergency room beds. As a tertiary care center, we see a variety of pathologies and at times manage incredibly sick patients.
We have 4 inpatient teaching teams. Our teaching teams are staffed with 1 attending, 1 senior resident who is a 2nd or 3rd year resident. They supervise 2 interns, which we refer to as junior residents, and up to 4 medical students. Pharmacy residents and observers are always welcome and frequently join rounds. Our faculty use a combination of bedside and table rounds for teaching. We use Epic as our EMR for both inpatient and outpatient.
We increase our patient cap slowly to make sure you have a gradual increase in responsibilities as you start your training.
For a typical day on floors, you will receive sign-out from the night team, see your patients, pre-run with your senior, formally run with the team, have a protected conference time from noon to 2, and finish your work before signing out to the night resident.
Teams are on call every 4th day. On a typical call day, which is from 7 a.m. to 7 p.m., the admission time starts from 10 a.m. until 7 p.m. When you're done with your work, you'll sign out to the night team and end your day.
On a weekend for a non-call team, once you are done with rounds and finished with your work, you can go home but are still responsible for your patients until 6 p.m. The call team schedule will be the same as mentioned previously from 7 a.m. to 7 p.m. Taking time for yourself is important. While working on the floors, you'll typically have 1 day off per week, totaling 4 days off every 4 weeks.
We added a new rotation called Rapid Response, where you will be responding to rapids, codes, and hospital emergencies from 9 a.m. to 7:30 p.m. You will work with rapid response nurses and learn fundamental procedures and skills. You'll have a discharge line phone where you'll answer calls from recently discharged patients. On the weekends, you may be pulled to help ICU or floors depending on the census.
This is one of our ICU beds. The ICU rotation is one of the most intense rotations, but is often a favorite for many of our residents. So much so that many residents pursue critical care for fellowship afterwards.
The ICU has 2 teams, each team with 1 attending, 1 fellow, 1 senior, and 1 junior resident. In the ICU, our residents come a little bit before 6 a.m. to receive sign-out on their patients. In the morning, they pre-round gathering information about ventilator settings, drips, and discussing overnight events with the nurses. Then they have a multidisciplinary rounds. Our resident teams in the ICU alternate call every other day, with 1 junior and senior resident team leaving at 4 p.m. and the other leaving at 6 p.m. Each team also gets 1 full weekend off and works the other full weekend in this 2-week block.
You will be doing most of your procedures while you are in the ICU block. You are only required to be certified in central venous catheter placement, but you will have plenty opportunities to do other procedures such as paracentesis and intubations and lumbar punctures.
Let's talk about our night rotations. For our junior residents, there are 4 different types of night shifts. 1 junior resident in the ICU the entire block, 2 junior residents switch between admitting for 1 week and answering night pages and calls for the other week, and 1 junior covers each of these 3 shifts when the junior is off. Here, you see the schedule for each night rotation.
Now let's turn to our electives and selectives. Selectives are rotations which are required and complement the general scope of internal medicine. Things like cardiology, nephrology, and gastroenterology, just to name a few. And then there are electives like rheumatology, dermatology, women's health, and so on. Specialties you can rotate through based on your interests. While there are many learning experiences available, it is also a great rotation to catch up on your rest and enjoy your weekend.
Residents also have an opportunity in their 2nd and 3rd year to rotate at Cleveland Clinic, Ohio, or another hospital of their choosing.
On ambulatory and elective blocks, you will start the day with morning reading club with our acclaimed emeritus program director, Dr. Muniz. Afterwards, you will progress to your elective, subspecialty, or continuity clinics, break for conference, and then return to your duties. For our ambulatory block, on Wednesday afternoons, we alternate between point-of-care ultrasound curriculum and simulation plus academic half-day.
Just as the elective block, you work Monday to Friday and you're off on the weekends. During your clinic block, you'll also get a half day of admin time. You'll have time to enjoy the beautiful Florida weather and soak up the sunshine.
During our protected conference time from noon to 2, we cover a variety of topics. Our lectures are from Dr. Muniz, other subspecialty, faculty, and fellows, multidisciplinary team members, and guest speakers. On Fridays, we have journal clubs, internal medicine morbidity and mortality conference, intern talks, as well as wellness activities and house staff meetings.
During our conference time, we also have teaching rounds, similar to other programs' morning report. We discuss different differentials, workups, and treatment plans while building critical thinking in a safe learning environment. On Tuesdays, we focus on topics that are important in managing patients in the outpatient setting. The residents participate by presenting patients and having a formal presentation on topics discussed. We also have other conferences such as Cardio IM and ICU IM combined teaching rounds, pre-op, and readmission conferences.
As mentioned previously, on ambulatory and elective blocks, we have a morning reading club with Dr. Muniz from Mondays to Thursdays and Dr. Sider on Fridays. This is where we go through the Mixed-Ep Q-Bank, answering questions, and incorporating high-yield teaching points. It's no wonder why our residents have close to 100% ABIM board pass rate for the past 10 years, and I truly believe our strong didactic curriculum plays a huge role.
No wonder our graduates went on to fulfill their career choices. I look forward to our match result this year as we have a great group of PGY3s. Many graduates even choose to stay in Cleveland Clinic as they enjoy their training and the people they work with.
In addition to healthcare benefits, residents also receive book reimbursement and food stipends. We have recently increased the amounts for conference reimbursements for our 2nd and 3rd year residents. You will get an iPhone that also works as your pager. Another notable benefit is, aside from our maternity and paternity leave, we have home electives available for our new parents so that they can continue their training while spending quality time with their new family member.
The call rooms in a hospital have workspaces, sleep rooms, shower areas, fridges, and coffee and espresso makers. This is where our residents spend most of the time in the hospital. It's where they work, but also enjoy each other's company.
We pride ourselves on being a close-knit and family-like program. We celebrate birthdays and in welcoming the newest additions to our family. Small or big, same or different, we learn to accept each other for who we are and appreciate what everyone can bring to our program.
We start the junior residents with team building activities during orientation week.
From the first day of orientation to the graduation celebration, we build lasting professional and personal relationships with faculty and co-residents. We hope you look forward to joining us to become a part of this large family.
If you have any questions about our program, the interview day, or South Florida in general, please feel free to reach out. We look forward to meeting each of you and hope that you have found this presentation helpful.